So to understand what is a neck pain, you should be knowing certain kind of things, certain kind of anatomy behind it. So for that, I've just brought a small demo model of a spine. You can see this is a spine. So you can't appreciate at the neck level. So I'm showing at the base level. Here you can see these are the two bodies which are bony bones. Okay, in between something called as this is called as disc. A small, what do you call, a plastic thing is there. If you can appreciate these plastic things. So the major action of this is this is a shock absorber for the top and the below bones. Why I'm saying is because of this and because of these joints, the majority of neck pains will happen. So for that reason, I'm explaining it. So the neck pain is normally seen in people who is having an issue with this kind of bush and with this joint problems. People who are doing the bending activities just like this, or who are sleeping in this mode or this mode, or people who are using a very pounding pillows, not a regular pillow. The pillow is more than 3 inches or 4 inches. Or people who are sleeping abnormally, they are more prone for the neck issues. And the people who are having some kind of pathologies which are causing neck issues like such as arthritis, and even the people who are having some kind of joint infections are also prone for this kind of neck issues. The neck pain problem, if I say is, no one will see my video also. Why? Because the first thing when you take a phone, when you start seeing a phone, and you turn like this, I'll say like this. I don't watch like this. So in the moment when you move, flex your neck, immediately there will be some kind of strain over the neck. No one will watch like this. Even no one will do their laptop, or they will do their desktop, or they'll do their work in the same position. Always they will try to move it down because of whatever is the reason. So there will be a complete impact on the neck. So whenever there is a complete impact on the neck, definitely there will be a neck issue. So people who are using cell phones, and people who are using laptops, and people who are doing all kind of software things, definitely they are prone for neck injuries or neck issues. So who are using phones, always they should have a neck support, which I am using. You can see my this thing, what is that? Chair is having support up to the neck. And if I ever want to watch, I'll watch like this. Even my desktop is at my level of this side. So if I want to use something, I'll use that. I don't want to bend my neck. Whenever I prevent bending the neck, definitely that will give you very relaxed. That neck will be relaxed. Whenever the neck is relaxed, definitely you won't go for any kind of neck pathologies. So my sincere advice is, whenever you use any kind of devices, why? Because these days devices are common things. Try to use it in a upright position. Well, how I am sitting. Even if you are using a cell phone, try to use like this. If you are sleeping position, also sleep like this and use like this. Don't bend your neck. People who are bending the neck, definitely they are prone for neck issues. Initially, you should know what will be the other issues. So I'm having an issue with this kind of disc, but the patient will come to me saying I have numbness on the hand. So what is the relation between this disc and this hand? If you can understand, definitely you will understand what is the major complication for the neck pains. So whenever the neck pain comes, this disc will always protrude inside. That is called as ligamental prolapse, intravertebral ligamental prolapse. This, if it comes a little, it is called as protrusion. If it comes more, then it is called as extrusion. So in case of extrusion, what happens? Here you can see these are all the yellow color things. These are all the nerves. So these are all the nerve roots. So these nerve roots starting from the brain. If you think brain as a central government, and this inside inside holes, something called a spinal cord will be there. That is called that you treat as a state government. So all the things are governed as by the state government. Like that only all our hand movements, hand power, tactile sensation, everything is ruled by these nerves. You can see these nerves. Whenever this disc start producing, or this disc start when the disc completely prolapse, or when the disc completely extrudes, when the disc started compressing this nerve or the nerve root, definitely you'll have something called as tingling and numbness. That's the first symptom. And initially, if you can really go for an examination, first sensation to be lost is vibration sense, then tingling and numbness, then weakness of the bone, weakness of the muscle power will come down. And if that progresses more, then it causes automatic bladder, where the bladder or bowel will not be controlled by ourselves. It automatically voids by itself. So these are the normal symptoms which we are regularly seeing in case of patients who are suffering with neck pain. Once you get a neck pain, that definitely shows that you are having some kind of ergonomical issues, like you are not maintaining your posture properly. So in spite of that, if you get a neck pain initially, like if you try to change your ergonomical issue, definitely you will come out of this neck pain. 50% of the people can escape these neck issues. Still, if you get neck pain continuously, sometimes the people cannot move the neck sideways and up and down. Whenever they try to move the neck, they'll get more and more amount of pain. As we discussed, if you get tingling, numbness, or if you lose any kind of sensation, sensory things will be lost, or if you lose some kind of muscle power, that is the symptoms where you have to definitely go and consult a doctor. The treatment depends upon the severity. If the patient has severe neck pain, which hampers his sleep cycles, or which hampers some kind of mood disturbances, definitely the patient should go for a doctor. Or the patient, if he has a tingling or numbness in the hands, or the loss of muscle power, or loss of vibration sense, or any kind of sensory loss, definitely the patient should be going for a doctor to have a treatment. And the treatment again options are initial stages can be treated with some kind of muscle relaxants and some kind of painkillers and some kind of anesthetic medication. And even with advanced treatments such as nerve ablations, this kind of neck pains can be reduced. And even with a steroid intake, that is called an intra. So we can go with a epidural steroid into the joint, to the epidural space, and we can inject something called as steroid. So that also will cause us the reduction in neck pain. If that is severe and progresses to more, then you should go for surgical approach, such as removal of this disc where this is causing an issue. If there is a problem with the joint, that is called as spondylolisthesis, where bone will move forward or the backward. So wherever is the position translation, we should correct it by using something called as bridging plates or bridging rods, which are called as medical screws. So first measure is to prevent neck in a straining position. So what is a straining position? As I have explained, if you turn like this is a neutral position for the neck. And if you have something support, and this is the relaxing position of the neck, and you do something like this, if you lift it, this is with 50% of your neck is under strain. Again, you lift it, now 60%. Now you are doing this much. This is 100% of your neck is in the strain. If this is this much, if you do it, definitely the neck muscles will be completely tensed, where definitely this should be prevented. And second thing, as we discussed, when you start using your smartphones or something, don't bend like this and lift it and see. Make a habit like this. Definitely 90% of your neck issues will be treated. And even when you are using a chair, the chair should not be below your shoulder. It should be above your neck. At least it should touch this occipital region. It should touch up to this level. And if you see something, majority of time, try to lean like this and do your work, so that it prevents majority of pains and all. Even in certain places like in Australia and all, people are some software people, they are using laptops or even monitors in the supine position. They'll stand and they'll work. By standing also, they will do the work. By standing and by in an upright position, they will start doing their work. With that kind of thing, definitely the patient, you can prevent such kind of neck issues. And whenever you get a neck the pain, don't try to massage the things out. Try to go and consult a doctor immediately so that your treatment period will be less. If you take your home remedies and try to do some kind of gel application, certain type of local applicants will definitely treat the root cause, but they won't act immediately. They don't directly go into the this thing neck and they inside, and they won't reduce. Which are reducing immediately, they are not working. Which are not reducing, they are with some time during the using of that kind of gels or applicants for certain time. Definitely, they will work, and they will have their own what is the treatment options. So my sincere suggestion is, please try to consult your doctor immediately if you have a neck pain. And home remedies are only thing is that regarding the neck pain, try to prevent it. Once you get a neck pain, try to go on show. Why? Because the root underlying cause will be like it's an iceberg phenomenon. What you see is very small. What you see inside is very big. Then definitely you have to suffer a lot. And people definitely they need their neck nowadays. Without neck, you can't do anything. So my sincere suggestion is, try to do an ergonomical changes in your lifestyle. And along with that, if you get a small or initial small momentum of pain or something, definitely go and show a doctor.